Hello and welcome to this module which is called Teaching and Learning in the Clinical Environment. My name is Lizzie Hall and I'm your module leader for this and the other clinical pedagogy modules. A little bit about me. My background clinically is in dental. I'm a dental therapist in terms of my clinical qualification. But obviously, as you can tell, I also have a role in education. I teach throughout the Master of Education programme with UHI. I teach clinical pedagogy and digital pedagogy. Although my background clinically is within dental, and that might be quite different to yours, I think that much of the teaching and learning, both in clinical skills and in the clinical environment, can be related not just to dental, but also to medical, nursing, physio, and various other different allied health professions. It's the same in terms of what we need to teach people to show them how to work in a clinical situation prior to actually independently working with patients. So I hope you enjoy this module. This one, like I said, is on teaching and learning, but there's also a second module which runs in semester 2, which is about assessment within the clinical environment. So we're not going to talk much about assessment of students in semester 1, although I think it's important to recognise that it is difficult to separate these two things out, and that our teaching is always reflected by the level of achievement in assessment, and that students have also the level of evaluation that we do of our own teaching and learning in order to be able to improve things for themselves. So as I say, it's difficult to separate them out, but I'm going to try and focus on just how we deliver teaching and how to aid student learning, both in the clinical skills, sort of a simulation environment, and also actually in the clinical environment with real life situations. So this module is divided up over a series of weeks. Initially in this week 1, we're going to mostly do introductory things. But straight away, what I would like you to consider is how you learned when you were doing your undergraduate qualifications, when you were training clinically, and how you've either have or intend to translate that into you working as an educator clinically. I hope that you enjoy the module as a whole, and there's a number of things that you need to be thinking about just now in order to be able to accomplish these things throughout the weeks that you're going to be on this module. One of them is observation of other teachers. So what you're going to need to do is to attend clinical skills and clinical teaching sessions that are run by other educators within your remit, ideally, in order to be able to evaluate how they're teaching and to try and pick up on some of the good practice that you feel they have in a way that you would like to then use yourself with your own students. Obviously, it's very important to understand we all have our own personalities and our own sort of quirks in the way of getting things across. But it is important to think when you watch other people and get a feel for what they're doing that might also suit you, despite maybe having slightly different approaches. Oftentimes we find it's easier to think about organising a clinical skills session, so a simulation teaching session, because you're the teacher, you're in charge of that, you know what's going to happen, and you can plan it out to work that way, and you know your intended outcomes. But when it comes to actually teaching in a clinical environment, that is quite different, because there's only so much you can plan for. Patients are all different and their needs are different. But we still need to be aware and consider those as teaching sessions. So we're going to touch on that as we go on throughout the module, and always thinking that there's more to supervision than just checking your student isn't doing harm, for example. Through observations, explanations, descriptions, that is all a learning environment and therefore a teaching session. And so as I say, please make arrangements to observe others. I'd also like you to report on those observations. And this is what we would call peer review. There's going to be multiple episodes of peer review throughout this module. And in your report, you're going to do some analysis of what their strengths and weaknesses are, what the opportunities are in terms of improvement, and what might go wrong if things don't improve. And that's what we would call a SWOT analysis. So SWOT, strengths, weaknesses, opportunities, and threats. So I would expect you to do a SWOT analysis for each of these observation sessions, and then you can build your own portfolio of observations. And at times throughout the semester, I'm going to ask you to contribute to discussion boards, and you can use that information that you've got from the peer reviews to be able to contribute to those. So I'd like you to try and work with one another, because there are going to be more than one of you on the module. And we are going to use discussion boards mostly to be able to do that. You might also want to discuss things with me, and that's absolutely fine. You can always get me through email, is generally the best way to do it. Although I would encourage you to use discussion boards as well for that purpose, because it's really important to remember, if you have a question, you're probably not the only person with that question. You're going to probably hear me say there is no such thing as a stupid question a lot. I never ever want you to apologise for asking something. If you have a question, it needs to be asked. So please feel free as much as you can to put your questions in discussion boards, and then everybody can benefit from the answers. So I hope you enjoy yourself. You're going to see a lot of different forms of learning resources from me. Some of them will be video presentations like this, but there's lots of other methods that I use. And whilst you're accessing the learning resources in order to understand the content, it's also worth considering how they're being presented to you as well. And you can link that to your assessment, which does involve producing teaching and learning resources. You're doing a fully online course with what we call asynchronous teaching, so teaching that doesn't require us all to be in the same place at the same time. And there's a number of advantages to that. Sometimes in the clinical setting, we get a little bit stuck in this traditional model of education where you need a student sat in front of you, or multiple students sat in front of you, and they need to sit and listen to you. But in actual fact, there's an awful lot of courses now that are running quite differently. In fact, the BSc Oral Health Sciences that I also teach on with UHI is an undergraduate clinical course. However, around 50% of our teaching is actually done asynchronously, using various different online techniques. So I want you to bear that in mind whilst you're thinking about how you would teach and help people learn, about the times when you definitely need to be face-to-face, and the times where you think, well, could we provide this in another way? So I'll leave it at that just now, but I look forward to having discussions with you all, and I hope you enjoy the module.